page numbers. Chapter 12, Microminerals, Iron. 226 is the same page number in the new book as well. So we'll start today's session. So about iron, body contains around 2.5 to 4 gram of iron stored, okay, in various parts of the body. We'll discuss in which all form and which all parts of the body iron is stored, okay. So it is considered as a trace mineral. Trace mineral and micromineral are the same. They have the same meaning, okay. Just wait for a minute. So trace minerals and microminerals, they carry the same meaning, okay. The important minerals, it does not mean microminerals means they are not important. They are quite important for your body functions, for biochemistry in the body, but the body requires them in very small amount. Iron is a very important mineral for your body, for your health, but the requirement that you see on a daily basis, on a RDA basis, what your body actually can absorb and requires, okay, that if you take that in milligram or gram level, it is very less as compared to calcium. Okay, calcium we require around 1000 mg per day, 1200 mg per day, based on what kind of physiological stage of the life cycle you are in. Okay, so compared to that, where is the 1000 mg and where is just 2.5 or 5 mg of iron that you require on a daily basis? Okay, somewhere like that. So it's a trace mineral. It is considered as a trace mineral. You require it in very small amount, okay, on a daily basis. So iron is considered to be trace mineral, although the amount needed is somewhat more than the other microminerals if you compare it to selenium, zinc, okay. These kind of minerals, the amount required of iron is much more. We will discuss the reason why the required iron when you eat the food is much more, but the kind of iron that is absorbed actually by your body is pretty much less, okay. Other trace minerals or trace nutrients, microminerals are nickel, silicon, vanadium, cobalt, selenium. Okay, these all come under the other trace minerals that you require in the body. You do not have to worry about the RT, are you getting it or not? In any cereals or pulses you take, okay. Soil naturally has all these minerals, so definitely whatever is grown on soil, fruits, vegetables, cereals, pulses, they all have these microminerals, trace minerals in considerate amount that is more than sufficient for your daily requirement. So now coming to the distribution of iron. So the total body iron is around 2.5 to 4 or 5 grams, depending on are you a male or a female. Males will definitely have higher amount of iron content, okay. And also, like for example, around 1000 mg of iron is stored, and 1000 gram of iron would be not gram, 1000 mg of iron is stored in the body of a male, and it can be stored for up till 3 years and for adult man. When it comes to females, okay, when it comes to females, it's hardly 300 mg that can be stored, and it is stored only for 6 months. Okay, whatever iron that you have, if you are a woman, whatever iron right now you have in your body, if you do not take considerable intake of iron for the next 6 months, you will deplete your iron resources within 6 months. But for a man, it is 3 years. Okay, it's because of specifically if a woman is in the reproductive age group. Okay, majority of the Indian population, women population in India is in this particular age group, reproductive age group, and they are menstruating. Okay, so that is the reason why iron loss is seen higher in women. So 60 to 70% of iron is in the form of hemoglobin within your blood. Okay, 15 to 30% of iron is stored in the liver and also in your reticuloendothelial system, that is RE system, which means your bone marrow, spleen, and all that produces reticulocytes, RBCs. Okay, reticuloendothelial system is the system that comprises of your bone marrow, okay, and along with your spleen, which helps in the production of red blood cells. Okay, so 15 to 30% is stored in liver and RE system in the form of ferritin and hemosiderin. So ferritin and hemosiderin are designed for the reversible storage of iron. Okay, they small amounts of ferritin are present in your plasma, running in the plasma in the blood circulation. Okay, and they immediately, as soon as some iron loss is detected. Okay, these ferritin, the iron stores immediately from the ferritin is distributed back into the body. Okay, hemosiderin is kind of a polymer which is found in your intestine in the form of ferritin micelles. Micelles means it's a fat, and inside that fat you will find the fat layer. It will find the iron molecules. Okay, so again, they are stored in such a way that whenever the iron distribution falls down, that's when the ferritin and hemosiderin uh, iron molecules open up for the utilization of iron within the body. That is the reason how they are stored in the liver and RA system. Okay, then myoglobin, that is your muscles. Myoglobin is a form of protein, that is a form of muscle protein. Okay, so 4% of iron you find in your muscles. All muscles, skeletal muscles, okay, voluntary, involuntary muscles, all muscles have myoglobin, and 4% of iron is stored in the form of myoglobin within your muscles. 0.1% is in the form of transferrin in blood plasma. Transferrin means the iron that is currently in motion. Okay, from the intestine, when the iron is absorbed and it has to travel through the bloodstream, it has to reach the liver or endothelial system, wherever it has to be stored. The iron can move in the blood circulation only in the form of transferrin. Okay, so is it clear how how iron is distributed in a human body? It is more or less very similar for men and women. They do not have a different percentages. If you are an adult man or woman, this is the same distribution that you will see in both the genders. Is it clear to all? Next is the functions of iron. This is important from exam point of view. Functions of iron is important. So first is the transport and storage of oxygen. Since majority of your iron is found in hemoglobin. Okay, hemoglobin contains around 3.34 mg of iron. Okay, so because of the hemoglobin, because of the iron content in the hemoglobin, oxygen molecules are able to be attached to hemoglobin. So that's the reason how RBCs are able to carry the oxygen molecules to different parts of the body for energy utilization. Okay, so that is the one main function of iron. They help in the transport and storage of oxygen throughout the blood circulation. Then cofactor of enzymes and other proteins. Cofactor means in the presence of iron. Okay, in the presence of iron as an enzyme, various other biochemical reactions in your body, okay, it takes place. That is how cofactor works. Okay, so in the conversion of beta carotene in the form of active form of vitamin A. Beta carotene is the vitamin A that you get from plant-based food. Okay, all the plant sources, the way how vitamin A you get from plant-based source is in the form of beta carotene. There are other forms of plant-based vitamin A as well, but beta carotene is the most common one that is most readily absorbed by your body as well. Okay. In the form of beta, if you want to convert the beta carotene into an active form of vitamin A, because if your body wants to utilize vitamin A, if your body wants to utilize uh, beta carotene, it cannot store beta carotene, it cannot utilize beta carotene as it is. It has to be converted into active form of vitamin A. For this conversion to take place, iron is required. Also, for the synthesis of purines, okay, if there is too much of purine in your body, you will get gout disease. Okay, but a certain amount of purine has to be synthesized within the body. So for that also, and to synthesize your RNA and DNA, okay, iron is required. Other is the synthesis of carnitine. Carnitine is also a vitamin-like substance. Okay, it's a vitamin-like substance. It's not a vitamin yet. It is not considered as a vitamin yet. Carnitine is like vitamin-like substance, and it is used for the transport of fatty acids. If you are aware of it, have you ever heard about L-carnitine supplements? Those who work in the gym sessions, etc., they would know. Have you ever heard about the uh, L-carnitine supplementation? those who are working as a gym trainer or in the fitness industry, you may have an idea about L-carnitine supplementation. Not just heart protectant, it is known as a weight loss supplement. That's how L-carnitine is marketed. Okay, it is marketed as a weight loss supplement. It usually does not always function. There is no direct research studies which we have so far which can conclude, with the help of which we can conclude that yes, L-carnitine is a healthy weight loss supplement. Because the reason being, with the presence of L-carnitine, your fatty acids, large fatty acids, they can be broken down into smaller chain fatty acids, and it helps in the transport of fatty acids from one point to another. So that's how it is marketed. Okay, people who have cholesterol issues and all, for them L-carnitine would work to a certain extent. Okay, to a certain extent, to just break down that plaque. Okay, and to prevent plaque from forming within the blood circulation. For that, it's a really good factor. But apart from that, the way how L-carnitine is marketed, it is for weight loss purposes. Okay, so yeah, for the production, your body itself can produce carnitine in a good amount that can protect your heart. Okay, that can keep the large chain fatty acids away from getting clogged and causing issues in the blood vessels. Okay, so your body has enough amount of capability to synthesize carnitine, not L-carnitine, carnitine on its own. So for the synthesis of carnitine, you require iron. And there are other syntheses also. For example, collagen, which helps giving you a youthful appearance. Okay, the collagen prevents your skin from aging down, and it prevents the wrinkles. Okay, so it's kind of a pillar that holds your skin up, collagen and elastin fibers. Okay, so for the production of collagen and other proteins in the body as well, iron is required. Detoxification of certain drugs and toxic, if you are on certain drugs, certain medications, chemotherapy drugs and all. So for the detoxification of that, iron is required. And synthesis of neurotransmitters like dopamine, serotonin, norepinephrine. Okay, to make these hormones, iron is required. That is the reason why we will see in the deficiency of iron, people who specifically adolescent girls who are deficient in iron. Most of the iron deficiency is seen in the teenage girls. Okay, so adolescent girls who are deficient in iron, they have a higher risk of falling into depression because dopamine levels fall down. Okay, laziness, they inactive lifestyle because epinephrine and everything is down. Okay, dopamine and serotonin levels, if they fall down, this is one of the main reasons which leads a person into a stage of depression. Then formation of RBCs, red blood cells. There is a specific physiology in that. We will discuss it. So stem cells, this is a hemocytoblast. Whenever the name blast comes at the end of, this is a medical terminology perspective. Okay, so those who are not from a healthcare or a medical background, those who are from a medical background, they can answer in the chat box. What does it mean when you have a cytoblast at the end of any terminology? What does it mean? Cytoblast. Cyto means it is related to cells. Cells are called as cyto. With the medical terminology, we refer to cells as cyto. Sites or cyto. Whenever there is a blast at the end of a medical terminology, what does it mean? Yeah, it means immature cell. Okay, it is not in its maturity, it is not functional. It is immature. It has to undergo certain processes and stages to be functional. Okay, so hemocytoblast is how it is found in our bone marrow. Okay, the immature form of RBC. It has to undergo certain physiological changes. It has to become pro-erythroblast. Now, pro-erythroblast, erythro, the name came, it means red. Okay, erythro, it means redness. So it is going to become RBC, pro-erythroblast. It is going to become RBC. So this again, it is in your bone marrow. Okay, all these development stage takes place within your bone marrow. After it becomes a photoerythroblast, it's a natural physiological change. How many days does it take? Any cases? How many days it would take for the RBCs to form, new RBCs to form, or what is the life cycle of an entire RBC of one RBC? Any guesses? Approximately. It is 120 days. Okay. Within every 120 days, this physiology is taking place within your bone marrow. Okay. So after it comes into an pro-erythroblast stage, it forms into early erythroblast stage, because ribosome, RNA synthesis, and everything is taking place. And next, the hemoglobin will form. For hemoglobin to get accumulated in the RBC, there are other factors that is required: the presence of vitamin C, the presence of vitamin B complexes, copper. Okay, these all should be there. Only then this maturation takes place. Okay, early erythroblast, that is immature RBC, late erythroblast, little more maturity has come, that this all takes place in different phases. These phases you do not have to study in detail. You just have to understand that all these takes place, all these physiology takes place within your bone marrow. And for these physiology, for these processes to move forward, the presence of iron, not just iron is very, very integral component for this formation. Apart from that, copper, vitamin B complexes, okay, vitamin C, these are required for RBC formation. Okay, normoblast, and after normoblast is formed, the nucleus, you see the nucleus which is there, it has to be enucleated. Okay, RBC is a kind of cell which does not have a nucleus. WBC has nucleus. Okay, white blood cells has nucleus. RBCs don't have nucleus. Okay, so it has to be denucleated, and then it will form a reticulocyte. Reticulocyte is in the form, the RBCs are let out of the bone marrow into the blood circulation. Reticulocyte is still immature. It cannot function as RBC. It has to be in the blood circulation, and then it becomes erythrocyte. So erythrocyte is the final matured form of RBC, which is capable of taking oxygen, getting attached to oxygen and depositing oxygen molecules wherever required for other functions. Okay, so this is the entire formation of red blood cells. In detail, they have given the explanation in the textbook. You can just read through it. Just you have to understand all these phases takes place within the bone marrow, and it has to your erythroblast has to undergo denucleation. The nucleus has to be removed. Only then it is functional. It can work as a functional RBC. In the form of reticulocyte, it enters your bloodstream. It enters the blood circulation. Okay, and within few weeks, it forms into erythrocyte within the blood circulation, and that's how you get a mature RBC. Okay, is it clear so far, the formation of RBCs? So next is the absorption of iron. So the dietary iron that you eat, it exists in two forms: non-heme and heme. Okay, heme is a protein. Heme is a protein, and this protein form of iron is only from the animal sources. Your meat, organ meat. Okay, dairy products do not have iron. Milk, or any other dairy products, they do not have iron until and unless if it is fortified. If it is a packaged milk and you're buying the fortified milk, milk can be fortified with iron and other components as well. Vitamin B12, vitamin D, iron fortified milk. This kind of fortified milk is available. But in its natural form, the presence of iron in milk is almost negligible. Okay. So excluding the dairy products, all the other meat products, okay, they have iron. And the form of iron that you get from animal sources is called heme iron, because there's a protein that is attached to this iron. Okay. All the iron that you get from plant-based sources is the non-heme iron. Your body can actually readily absorb heme iron. the one that has the iron that has protein component to it, only that can be easily absorbed and utilized by the body, but not the non-heme iron. So yeah, absorption of iron, it enters your stomach, it enters the intestine, and in the intestine it has to undergo one second, yeah, it has to undergo transfer conversion from in the form of ferroprotein. It has to be converted into ferritin. Okay, it gets absorbed in the intestine in the form of ferritin, and ferritin can go in two ways. It can go into the form of sideroferritin, that is, it gets absorbed into the micelles. Micelles means it is surrounded by the fat cells, and it gets absorbed in the form of sideroferritin, and it stays like that, and it goes to the liver and your reticuloendothelial system. It is stored there, and whenever there is an iron deficiency, whenever the iron levels fall down, the sideroferritin will be used up for the further biochemical reactions. Okay, so in the form of ferritin, ferritin, it is getting absorbed into the intestine, and they have to be converted into ferroprotein, and ferroprotein can convert it itself into transferritin. So in the form of transferritin, the absorbed iron can actually leave the intestine. Otherwise, it cannot move around the blood circulation. Okay, it has to be in the form of transferritin. A specific protein comes and attaches to the ferritin, and it becomes transferritin, and that's how iron molecules can travel through the blood circulation. Okay, so transferritin levels are pretty minimal in your blood circulation. Okay, it is just 0.4%. We have seen that distribution. Okay, and once it is into the blood circulation, it can be deposited back into the liver, in the spleen. Okay, spleen is the part of your reticuloendothelial system. So in the form of when it goes and gets deposited in the liver and the spleen, it is converted back into the ferritin. The way how it was absorbed into the intestine, the same way it is converted back into ferritin in the form of sideroblast or transferrin. Okay, and then it will be used up whenever the iron levels fall down. It will be used up. So this is how the absorption works. Now, when you have to find at what level of deficiency you are, this is very important when it comes to iron deficiency anemia, the stages and everything. We will discuss that later when we come to the discussion part of anemia. So metabolism, feces, around 11 mg of iron is lost in feces, because the absorption part of iron is so tricky that it requires specific environment. We will discuss all the factors that allows you to absorb iron quickly. We will discuss that. It's coming up. In feces, majority of the iron is lost in feces because the majority of iron is not absorbed. Okay, only 2 to 3% of the iron that you consume can be absorbed. Remaining everything will be excreted from your body in the form of feces. And in women, menstrual loss. Okay, 28 mg of iron is lost in women on a monthly basis because of periods, because of menstrual loss. And desquamation. This is seen in everyone during the winter season. Okay, in the winters, you must have observed that you have dry, flaky skin, the white color flaky skin that even you rub or you scratch, you get that dry, flaky skin. Okay, and people who specifically have dry skin, even if they remove their trousers or something, the white colored flakes, they scatter all around the body. So that is desquamation. Everyone goes through that. Okay, so in desquamation, what happens is that the flakes that you shed, it's commonly called as skin peeling or skin shedding. The flakes that you shed, that also has iron. Okay, and around 1 mg of iron is lost during desquamation. Desquamation is the medical terminology of skin peeling. Okay, even when you do these cosmetic procedures, chemical peels and skin peels, okay, there also desquamation is taking place. Okay, you are losing certain amount of iron from your body in the form of your chemical peels as well. Okay, any form in which your skin is peeling away, you are losing the iron from the skin as well. So it's very less, it's 1 mg, but this formation is accelerated during the winter seasons in everyone. Okay. So iron balance, since iron is a very integral component in your physiological functions, there is a way how your body has to reutilize it. Okay, the body cannot afford losing iron. The ways how a human body can lose iron is is quite high. Okay, when it specifically when you take in consideration of all the women. Okay, the way how you the opportunities of losing iron is much higher, and the opportunities of absorbing iron through the diet. First, getting iron in the diet itself is difficult, and the second part is the absorption of iron. That is also tricky because there are lots of inhibiting factors of iron absorption. We will discuss that soon. Okay, so the ways how you are able to lose iron is much higher than the ways how you can actually store and keep iron in the body. So the body naturally has a physiology of reutilizing the iron. So first is reutilization of catabolized red cells. So we know that every 120 days, approximately, okay, it's not exactly 120 days, approximately 120 days, your RBCs has to undergo the shift of life cycle. Okay, so by that time, when the old RBCs, okay, all old RBCs, they reach the spleen for this reutilization. Okay, all the RBCs that require recycling, okay, they reach the spleen, and spleen is the place where it will choose the iron. It will take the heme iron from the hemoglobin part of the RBCs. It will take the heme iron back, store it in the spleen. Okay, the remaining part of the remaining parts of the RBCs is shed in the blood circulation. Okay, so that is how the reutilization of RBCs takes place. That is reutilization of catabolized RBCs, red blood cells. Catabolized means broken down. Catabolism means you broke down. Then upper limit cessation absorption. Does anyone have any doubt in? Yeah. Catabolization means breaking down. Okay. When the RBC breakdown takes place within your spleen, the iron which was RBCs, you already know, has iron in the form of hemoglobin. Hemoglobin is the has the majority storage of iron within your body. Okay, so when the RBCs are getting broken down in your spleen, the heme part of the iron is not lost. The spleen will try to store maximum amount of your heme iron within itself. Okay, so that is the reason why spleen is also a storage factor for iron. Okay, it is able to store iron because of the reutilization of RBCs, broken down RBCs. Is it clear now? Yeah. So next is our upper limit cessation. So whenever the iron, whenever you indulge in too much of iron-rich food, okay, in that situation, whenever there is too much of iron-rich food, obviously your iron concentration in the body has reached a certain upper limit. Your body will shut down the iron absorption from the small intestine. Okay, so that is the upper limit cessation in absorption. There comes a time when your body will shut down the excessive absorption of iron from the small intestine. So that is upper limit cessation. So that the balance, that healthy balance is there, because iron toxicity is also a real thing. What kind of situation arises when there is too much of iron? We'll discuss with examples later. Then is the ferritin molecules. So the specific storage protein, ferritin, okay, these can store and release the iron to meet excessive demands, specifically when it comes to pregnancy. Okay, in the last trimester of pregnancy. This is where in the last trimester of pregnancy, this is where the ferritin, which is stored in your liver, throughout the first and second trimester of pregnancy, you are having iron tablets. Okay, women are continuously taking iron tablets, storing up the iron levels within their body, so that the body can prepare for the last trimester. Okay, in last trimester, it's very tricky. The absorption part is very tricky. You already suffer from constipation. Okay, you are bombarded with a lot of nutrients and everything, and calcium intake also increases, and the iron absorption gets very tricky during the third trimester. So the ferritin levels, which are already stored in the body, which the pregnant woman has prepared storing all the iron through the first two trimesters, this ferritin levels will be used up for the excess utilization in the third trimester. Okay, so that is how ferritin comes into play. So this is how the body has its own mechanism to create an iron balanced atmosphere within the body. Is it clear to all? Any doubts here? And also, not just in pregnancy, also whenever there is an accident, any traumatic injury, you suffer from excessive blood loss. Okay, in that situation also, the ferritin which is stored in the body, that will be released into the bloodstream for utilization. Okay, pregnancy is just a natural physiological process. Apart from that, in case of any accidents, severe hemorrhages that took place, the stored ferritin levels will be used up. Is the iron balance clear to all? So yeah, these are the two forms of iron present, heme and non-heme iron. Heme iron easily absorbed in the natural form, because heme iron, as I mentioned, heme is a protein. Okay, and heme iron is found in all the non-vegetarian sources. So this iron already comes with a protein attached to it, and because the way how our intestine is designed to absorb anything that has a protein attached to it. Okay, the protein channels are quite rich in our intestine, so that's the reason why heme iron gets easily and readily absorbed. Okay, and it is easy on stomach as well. And when you are taking iron supplements, if it is a heme based iron supplements, you can take it with or without food. You do not have to worry about any gastric issues. Okay, and it is not affected by stomach acid as well. Like hydrochloric acid is required. Okay, you require an acidic environment for iron absorption. So hydrochloric acid is required for iron absorption. Vitamin C is also required for iron absorption, but without that also, even if your hydrochloric acid situation is down, vitamin C intake is down, if you're taking a heme based iron supplements, it will not be affected by all these conditions. It's a natural non-GMO. That is a clinical area. You don't have to worry about it. Absorption is inhibited by calcium. Definitely, calcium will inhibit not just heme iron absorption, but also non-heme iron absorption can also be inhibited by calcium. Okay, and if the calcium intake, specifically when you are taking the heme iron supplement, if the calcium intake is more than 300 mg per serving during the same meal, it will inhibit the absorption of iron. Okay, but if the calcium intake in that particular meal or within 1 hour or 2 hour, whatever calcium you had, okay, if it is less than 300 mg, it will not have much effect. Okay, when it comes to the non-heme iron, 1 second. Yeah, when it comes to the non-heme, ferrous fumarate, ferrous sulfate, these are the examples of non-heme iron. Majority of the iron supplements which you used to get few years back, the majority of them were the non-heme iron supplements. They have painful side effects like constipation. Okay, gastric issues, if you have it on empty stomach, it may give acidity. Okay, it requires an acidic environment as well. Hydrochloric acid is required, vitamin C is required. And if you are having antacids, okay, if you are having acidity, you had antacid, and then you have this non-heme supplement, it will not be absorbed. Antacids will block the absorption of non-heme iron. Synthetic iron salts are also not a good option here. Synthetic iron salts, there are certain fortified iron salts present. Okay, it is not absorbed well, and the absorption is blocked by calcium, tea, coffee, anything that is that has caffeine, chocolate, okay, cheese, beer, green leafy vegetables that has vitamin K and calcium rich. Okay, green leafy vegetables are rich in calcium as well. Okay, that can also directly affect the iron absorption. Eggs, nuts, yogurt. See, you can see all the milk-based products, dairy products are shown here. Tea, coffee, wine, chocolates, anything that has caffeine will definitely, caffeine will not just block the absorption of iron, but can also block the absorption of calcium as well. Okay. So this is the main difference between heme and non-heme iron supplements. And also in the form of natural food, all these guidelines would affect there as well. So absorption factors, which are the factors that increases the chances of iron absorption. First is increased acidity. Okay, first your natural acidity in the stomach. Okay, and also in the mucous secretions of your intestine. Okay, intestinal juices and the stomach juices. Increased acidity naturally, it will help in the absorption of iron. Also having citrus fruits and vegetables. Whenever you are taking anything that is iron rich, having citrus fruits and vegetables along with that can enhance the absorption of iron. And if you are on any supplements, if you take your vitamin C supplements and iron supplements together, it is a much better opportunity for the absorption of both. Animal tissue protein, which is non-vegetarian source. Okay, so if at all you are having any iron-based, iron-rich food, even if it is green leafy vegetables or any other iron-rich food, if you're having it with a non-vegetarian source in the same meal, okay, that can enhance the iron absorption because of an MPF factor, muscle protein synthesis factor. Okay, so that absorbs the iron absorption by twofold. Just by the present, just if there is a presence of an animal tissue protein. Tissue protein does not means egg. Egg does not come under animal tissue protein. Okay, it means if you take an example of chicken breast, chicken thighs. Okay, which does not component not the meat that is associated with the bones. Okay, boneless chicken. Okay, boneless meat, they all come under animal tissue protein, not the organ meat. Okay, that the body need during pregnancy. Naturally your body will increase the iron demand. Along with that, iron absorption rate increases on its own. It's a natural physiology that happens during pregnancy. And also whenever you undergo certain surgeries, okay, if the blood loss, if the body identifies hemorrhage or blood loss, naturally iron absorption increases. And when a child turns from a child to it, she hits puberty. Okay, girls specifically, when they hit puberty, when they turn into an adolescent, naturally the body's iron absorption rate increases. So these are the natural ways. Also, when you do blood donation, anyone who does blood donation, the body has identified excessive blood loss. Okay, even though it was purposeful, body has identified it as a blood loss, just like an hemorrhage. So the iron absorption increases. Then the presence of lactoferrin and lactal albumin. So although human, this comes for breastfeeding. Okay, in human milk, iron content is very low, and in cow's milk and other form of cattle milk, it is much more low. Okay, the reason being the milk, it also already has lactoferrin. Okay, infants, they retain more of the iron from human milk than that of cow's milk. So that is the reason why we have to always choose breastfeeding human milk over any cattle milk, because the lactoferrin content in human milk is much higher than in cow's milk. Okay, just because of the presence of lactoferrin, the child's body, when you are weaning the child and all, when the child's body is able to identify and source iron out of the food, feeding food, whatever you are feeding your child. Okay, as soon as a 6 month weaning period starts, you have to focus more on the iron rich food, because the child's the human milk has negligible, even though it has a better composition than cattle milk, but the iron composition is quite negligible there. Okay, so that when the child is born, for the first 6 months, the child can take care of its own iron necessities. But after that, when you start weaning the child off the breast milk, when weaning diet is included in the child's diet, iron-rich food has to be given more importance there. Lactal albumin, that is also another form of protein found in breast milk that also enhances the absorption of iron. So that is the reason why for the next 2 years, as soon as the child is born, up till 2 years, when you breastfeed the child, lactoferrin and lactal albumin is what the child is getting. Because of the presence of these two elements, the child's body is able to absorb iron better from other food sources. That calcium, adequate amount of calcium will not directly support iron absorption, but it can indirectly support iron absorption by taking away some phytates and sulfates and making it into a precipitate and taking away from the absorption site. Okay, so it clears the path for iron, certain adequate amount of calcium. But if it is too much of calcium, okay, when there is too much of calcium, it will not help in the iron absorption, it will inhibit the iron absorption. So this is the reason why when we give an example of green leafy vegetables are good sources of calcium, it's a good source of iron as well. But why do we give an example of green leafy vegetable when we talk about iron rich food? This is the reason why the amount of calcium which is present in green leafy vegetables, it is adequate enough to take away all the other bind and take away all the other sulfates and phytates away from the absorption site and clear the pathway for the iron to be completely absorbed. Okay, this is the reason why calcium has been put here, but adequate amount. As soon as I mentioned, okay, more than 300 mg of calcium is given in the same diet where you are having iron, there it will cause the opposite reaction. Okay. See, earlier we used to say you have to keep at least 4 to 6 hours break between having iron supplements and calcium supplements. But nowadays, even if you are taking an iron supplement after having something, you had a calcium rich food, after 1 hour, 1.5 hours or so, you had an iron supplement, it is completely fine. If you are using the iron supplements which are made in this generation, okay. Earlier days, now we are in the 3rd or 4th generation of iron supplements, but the earlier generations of iron supplements which were made and distributed, for those type of iron supplements, you have to keep at least 4 to 5 hours gap between calcium rich meal and iron supplement. Okay. So the best time, I wouldn't suggest having iron supplements in the morning. Mornings, you can focus on protein and calcium rich food, because you can incorporate more of milk and dairy based components in the morning breakfast time. Okay. Around 11 o'clock or 12 o'clock is the time that is ideal time when you can have iron based supplements. Okay. And after an hour or so, you can have your regular meal. Okay? That is an ideal way. But avoid taking iron supplements when you are having curd. You know that you just now had curd in the meal, or any dairy based product you had in the meal. Avoid taking iron supplements at the same time. Next, coming to the is enhanced absorption factors clear to all? How calcium helps here? Calcium naturally is an inhibiting agent of absorption of iron, but adequate amount of calcium can just take away all the agents like phosphates, phytate, sulfates away from the absorption side. Okay, that is the only thing you have to remember here, how calcium helps. So this is the reason why we can conclude that green leafy vegetables are an ideal source of non-heme iron. So the absorption factors, is it clear to all? Curd also has calcium content. It is a dairy supplement. It's a dairy product. Okay, curd is also a good source of calcium based on the tone of curd which you are using. Okay. Next is inhibiting absorption, just the opposite of the enhancing absorption, low gastric acidity. If you suffer from a lot of peptic ulcers, okay, or you have undergone certain surgeries which have took away some certain tissues of your parietal cells, okay, certain parietal cell tissues have been removed because of some traumatic injury, surgery, okay, or naturally the parietal cell secretions are quite less in your stomach, that would lead to low gastric acidity levels. Okay, so that inhibits the absorption of iron. Increased gastric motility during diarrhea. Okay, or if you are taking any laxatives, if you are on any laxatives, or you're suffering from chronic diarrhea, acute diarrhea, in that situation also iron absorption decreases. And too much of fiber rich food, too much of fiber rich food can also decrease the iron absorption, because fiber rich food will increase your gastric mobility. Presence of phytates and oxalates. So this is what calcium is supposed to remove. Okay, phytates and oxalates are found in your whole grain cereals. Okay, and coffee, tea also has certain amount of phytates and oxalates. Okay, whole grain, multigrain, husk, any grain which has its husk, they have a lot of phytates and oxalates. Green leafy vegetables, okay, they also have phytates and oxalates. If the calcium is not able to take it away, the phytate oxalate content will be there, will be present. So that also inhibits the absorption of iron. Polyphenols present in tea, coffee, okay, cocoa, chocolates, and some other rare vegetables are also, whichever has polyphenols, that inhibits the absorption of iron. Then certain minerals like cobalt, zinc, cadmium, copper, these all have competitive absorption because they use the same channels of absorption what iron has. So that's a competition that is created here. So because of competitive absorption, too much presence of these trace minerals can decrease the iron absorption. Then infection, if you are suffering from any chronic infection, or regularly, frequently you contract certain infections, that could also lead to decreased iron absorption. Non-tissue proteins, such as milk, negligible amount of iron, cheese, eggs, okay, if these are your main sources of protein and you're not indulging, if you're a non-vegetarian, and then you're not indulging in any other meat-based based products, and the presence of this non-tissue proteins can inhibit the absorption of iron. Milk, cheese, and egg, milk and cheese, because they have high calcium content in it, that is one of the reasons. Coming to overload of iron toxicity. So the first situation is hemochromatosis. So you can see the comparison between a healthy liver and a hemochromatosis liver. Too much of iron, because liver is an organ that stores majority of our iron as well. So too much of iron will also be deposited in the liver. It will too much of iron in the hepatocytes. Liver cells are called hepatocytes. Okay, too much of iron stored in the hepatocytes will lead to inflamed liver. Okay, inflammation will cause swelling, enlargement of liver. It will automatically lead to liver cirrhosis, jaundice. Okay, all the other pathophysiology that follows when the liver is damaged. Okay, that is hemochromatosis liver. And this disease is a fatal condition. If it is not treated or if it is not diagnosed sooner, it can lead to a very fatal situation. So if you reduce the intake of iron containing food or iron fortified food, and try to avoid cooking in iron cast cookware. Okay, this is another solution for everyone. Iron cast cookwares are really good source to incorporate more iron into your food. But on a daily basis, if you are cooking in cast iron cookwares, and not just cooking, but you are storing the food in that. Okay, storing the cooked food in that iron cast iron cookware, that could lead to these kind of disease conditions. That could lead to iron toxicity. Okay. So limit your cooking in cast iron cookware to at least thrice a week or so, thrice a week. Cook it, and immediately after cooking, remove the cooked item into some other vessels, stainless steel vessels or any other container, but don't keep the cooked food in cast iron vessels. Okay, because over a period of time, more and more ferritin ions will be released into the food, and it can lead to iron toxicity. If you are using cast iron cookware on a daily basis, it can lead to iron toxicity. Second is siderosis. So siderosis is a very rare condition, but it was seen more in the South American and the Mexican region, South American Mexican region. It was seen more. So the eyes, you can see in the pupils of the eyes, that has a rusty appearance because iron, the powdered hematite powder or the iron ore powder, when you're working as a miner and all underground, okay, iron ores and all. So the hematite powder get deposited because of either you're breathing it in, okay, or because of storing the beer or any other alcohol in iron cast vessels and using it over a period of time, okay, indulging in drinks that are stored in iron vessels. So these were the reasons why siderosis was seen in a certain community. Okay, so this is one of the symptoms in which the eyes, you can see it is rusty brown in color because of the accumulation of hematite or the iron ore dust. This happens in miners as well, people who work underground in the mine. Okay, there also this can take place. So yeah, about these two toxicity disease conditions, questions can come in the form of MCQ. So these are the overload of iron situations. So underline that. This is an important part from exam point of view. Next, coming to the RDA. RDA, please check from the ICMR website. If you're, please be updated from the ICMR website. Don't depend on the textbook. The RDA may change. Can anyone just put in the chat box what is the RDA which you see in the textbook, those who have the new textbook for pregnant women and lactating women? Per day requirement. Iron in mg per day requirement for pregnant women and lactating women. Yeah, pregnant is 27. Lactating is 23. Is it same for all? Those who have the new textbook or old textbook, is it same for all? Okay. So please check with the ICMR textbooks as ICMR websites as well. Please be updated with that. Yeah, for exam, please study for the RDA from textbook. Don't depend on any other articles or sources. If you get any RDA based question, it will be very rare. Okay, RDA based questions are very rare in exams, but if at all, you come across such questions, the options that we give will have a stark difference. Okay, for example, for pregnant women, 27 mg per day, that would be one option. The other option could be 5 mg, or the other option, and some other option could be 80 mg, something like that. Just by looking at the difference in the option, you can understand what could be the ideal range. Okay, even if the number is not matching exactly what is given in the textbook. So please use certain degree of common sense there while answering the questions. Next is anemia. Nutritional anemia, we have a specific separate chapter for that. Before that, please check the iron content of plant and animal food. Do you have this table in the textbook? In the new textbook? Yeah. So that is for your practical purpose, okay? When it comes to classifying the best sources for vegetarians and non-vegetarians, okay? The best sources of iron-rich food. Specifically when it comes to preparing a menu plan for a pregnant woman or a lactating woman, these kind of tables will be very helpful for you. Per 100 gram, how much iron you can get. But these the numbers that you get is not exactly the truth, because of the demineralization of soil that happens these days. We cannot completely depend on it, but whatever information is available, you have to use the best use of it. Okay. So these kind of tables are for your practical use. Whenever you're making a menu plan, we'll come to menu plan assignments later. Some students have already done that who are continuing from the previous batch. But for new students, we'll complete certain chapters. After the completion of those chapters, we can just go with the, we will just give certain assignments. Okay. And I would request everyone to participate in doing the assignment, because very few students do the assignment. It's not compulsory, but only when you do the diet plan on your own, using the textbook, using the resources given in the textbook, and along with using certain websites, when you do the diet plan and menu plan assignments, only then you can understand how to use these tables. There are specific tables in the menu planning chapters of dietetics and all. Only if you do the assignment, you can understand how to use the tables, okay, for your future references. So ways to tackle anemia: causes, nutritional and iron deficiency in meals, either through blood loss during menstruation. It will be given later. Assignments will be given later. We have not given assignments for the new batch yet. Okay. So worm infections of intestine, it happens in children. Worm infections is very common in kids, very rare in adults or in old age people. It is very rare, but in children it is very common. Okay. One infections, tapeworm, hookworm infection. Okay. Chronic kidney ailments, hypothyroidism, endocrine abnormalities. So in these all situations, iron absorption is reduced, iron intake is also reduced. Okay. This is the main causes of anemia. So treatment for anemia: proper balanced diet, vegetables that are rich in iron, that includes spinach, carrots, radish, beetroots, tomatoes, potatoes, green leafy vegetables, fruits like bananas, apples, pomegranate, sapota. That sapota is chiku. Okay. Iron supplements should be taken only under medical advice. Okay. And in severe cases, you will require blood transfusion. We will see the different stages of iron deficiency anemia, and that we will discuss all this. This is just a generalized treatment for everyone who can use this information. It's a general advice for everyone. So iron supplements and blood transfusion only under clinical guidelines. Okay. Otherwise, the diet examples which we have given, it is something that everyone can use. Also, you can use the examples given in the textbook. It is much more accurate. Per 100 gram of serving of the different examples given in the textbook, vegetarian and non-vegetarian, what kind of iron intake you can expect is also mentioned. So symptoms: weakness, fatigue, shortness in breath, getting tired easily. Okay. Giddiness whenever you are sitting down and standing up immediately. Okay. Happens more in teenage girls and young women. Headaches, increased heartbeat, pale, dry skin. There is no lushness in the skin. Irritable mood, depression, okay, moodiness, These all are the other symptoms of anemia. Diagnosis, blood test is the best diagnosis. Don't just look at these symptoms, because these are symptoms which are true for other disease conditions as well. Okay, so to diagnose anemia, clinically diagnose anemia, blood test is important. RBC count, WBC count, serum ferritin levels, serum transferrin levels, okay, hemoglobin levels. These are what we check to diagnose what stage of anemia a person is suffering from. In some severe cases, if there is some bone marrow tumors or something, in that case, we may require bone marrow biopsy to see the amount of iron stored in the per square region of the bone marrow, etc. So causes of iron deficiency anemia. There is a table in your textbook on page number 240. Table 12.6. Is it the same page number in both the textbooks, new and old edition? If there is any change in the textbook, please mention in the chat box. 240 is the same page number. Yeah, this table is also important from exam point of view. Okay. In different age groups, okay, we will discuss that in detail. In different age groups, what are the causes of anemia in different age groups? So in infancy, if the child during the fetal stage, when the child was within the uterus, okay, mother was anemic, definitely the child will also be born with reduced iron stores in the liver, in the child's spleen, bone marrow as well. Okay. Also, all the low birth weight babies, okay, the preterm babies, they are born with naturally low iron stores within their body. Multiple births, giving birth to twins, triplets, quadruplets, okay, that is multiple births, multiple pregnancies, and multigravida mothers, that are mothers who have had children more than 3 times or 4 times, okay, multipara. Then infants who breastfed by mothers who are strict vegetarians, vegetarian mothers who are strict vegetarians. It is difficult for them to, if plus the vegetarian mothers, if they hadn't had iron supplements during their pregnancy, okay, and if these kids are breastfed by vegetarian mothers, high chance that the infants may also suffer from anemia. Late weaning, starting the weaning diet at around after 6 months or 7 months, okay. Impaired absorption of folate, that is something inborn, metabolic disorders, etc. Regional enteritis, too much of gastric infection in children. Okay, an infant who has suffered from lots of diarrhea during the first 6 months of age, and Crohn's disease, celiac disease. Celiac disease, disease is genetic. Okay, you are born with a small intestine villi that is more flattened. Okay, in childhood, dietary deficiency, not having proper diet due to worm infestations. In children, it is very common having bookworm or tapeworm infestations. Inflammatory bowel disease, IBS, neglect of female child. Nowadays, we are in a better social standing, but when it comes to rural India, still, when it comes to the dietary preferences and giving good food and good nutrition, male child is preferred over female child. It's a social factor. Okay, so neglect of female child, chronic diarrhea associated with any worm infestation, and unhygienic eating habits in kids. Okay, in adolescence, as soon as the girl reaches menarche means the first period. Okay, as soon as the period starts, puberty starts, and growth spurt that takes place, but not you're not having the adequate nutrition that is matching up to the growth spurt. Okay, within a month or 2 months, an adolescent, let it be boy or girl, they can immediately undergo a tremendous growth spurt. Okay, but the way how they are treated in the family, the kind of food that is given to them, it may not satisfy the growth spurt requirements. That could lead to anemia. And intensive conditioning of competitive athletics, iron depletion in girls, because they may go into dieting. Okay, they may suffer from some eating disorders that could also lead to anemia. early marriages, teenage pregnancies that could lead to anemia, and excess of blood loss during menstruation, because with or without any reproductive problems. Okay, if there is too much of blood loss, menstruating for more than 7 days, and excessive bleeding for the first 4 or 5 days, that can be considered as a reason for anemia. Then in pregnancy, increased requirements, but requirement is definitely increased, but the diet is not able to keep up with the requirement. And increased parity, as I mentioned, when the mother gives more than 3 births, more than 4 births, okay, multipara woman, okay, that is increased parity. Hemodilution, as I mentioned in few classes before, during pregnancy, your cardiac output increases, your blood volume increases, okay. Before pregnancy, if your blood volume, let's say it was just 1 liter, by the end of the third trimester, your blood volume doubles, almost doubles, okay. It could be 2 liter to more than that or something. Just an example, okay. Your blood volume doubles, and when the blood volume doubles and the iron intake has not increased, whatever hemoglobin is present, it becomes into a diluted stage. That is hemodilution that takes place in pregnancy. Then certain cultural beliefs and taboos of not eating that, do not eat it, okay, don't eat non-veg or don't eat this. Out of some cultural beliefs, some really good sources of iron-rich food and nutrition may be avoided during pregnancy because of certain traditional beliefs or cultural beliefs. And any pregnancy-related complications, specifically hyperemesis gravidum. That's a disease condition in which there is too much of vomiting, okay, morning sickness that continues up to the second trimester as well. Okay, the mother is not able to keep in any food, okay, any liquid food or any solid food. She is suffering from a lot of vomiting issues, so that could impair her nutrition. Not just the iron deficiency, but other deficiencies could also accompany. Then in old age, again, dietary deficiency and neglect of senior citizens, not taking care of their nutrition. And with age, your absorption reduces, okay, your small intestine absorption reduces. So that is another factor. And not able to digest certain iron-rich food, not able to tolerate certain food tolerances also shift during old age. A poor absorption, psychological problem, okay, menopausal situation in women, hormonal situations in women, that could also lead to iron deficiency. Gastritis or any lifestyle diseases that they have collected throughout the lifetime, and too much of their immunity also falls, so infection rate increases, and with increase in infection, iron absorption decreases. Okay, so it's kind of a vicious cycle there. And in adults, regular adults, if they suffer from cancer, tuberculosis, diarrhea, malaria, any surgery, road traffic accident, hemorrhages, okay, so these could also lead to iron deficiency. Anorexia nervosa, eating disorders in adults, okay, that could also lead to iron deficiency. So these are the causes of iron deficiency. Is it clear to all? The ones which we have shown on the on screen is very less, but malignancy means cancer. The cancer that is spreading, okay. Malignant cancer means it can spread. Benign cancer or benign tumor means it is static, it won't spread, okay. Malignant means it can spread. Is the causes clear to all in different age group and different stages of life? Coming to the clinical findings of anemia. Yeah, before the clinical findings, there are 3 stages of anemia. In the first stage, that is your iron stores are just getting depleted without any signs and symptoms. Okay, there is no signs and symptoms that you can perceive from outside. Okay, like depression or laziness or giddiness, pale skin. Okay, change in skin color, lack of focus. These things before these symptoms arise, when there's a depletion taking at the organ level, it is not something that you can understand. Okay, but just by doing dietary corrections, just by focusing on good diet, in this particular stage, in the first stage, okay, you can correct anemia immediately without any clinical help. Just by dietary habits, just by lifestyle changes, you can correct anemia here. Okay. And the second stage is the intermediate stage. And this is where your transferrin, as I mentioned, it is the molecule that helps to carry iron through the blood circulation and helps it get deposited in the liver, spleen, wherever it is required. Okay. So when the transferrin level comes down, okay, this is where majority of our Indian population is. Majority of the Indian population, 60%. Now it is more than 60%, around 70% of the Indian population is already anemic. And majority of them is in this stage where their innate stores are in the depleted stage. On top of it, if you take the serum transferrin level, that is also low. It is 30 to 15% less than the normal transferrin level that it should be. Okay. So majority of the Indian population who's anemic comes in this particular category, in this particular intermediate stage. Then it's the third stage. In this stage, immediately your hemoglobin concentration also falls down. So in third stage of anemia, you're not supposed to donate blood. For blood donation, there are specific criteria you have to meet. You have to weigh more than 50 kg. You have to be a major. You should not be a minor, above 18. You have to weigh more than 50 kg. Your hemoglobin levels should be adequate based on your sex. For females, it has to be more than 12 gram per deciliter. For males, it should be more than 15, around 15 or more, equal to 15 or more than 15 gram per deciliter. Okay, so this is the hemoglobin level you have to maintain. If it is less than that, you're not supposed to donate blood. Okay, your temperature, pulse, your blood pressure, it has to be normal, only then you can donate blood. So these are the criteria. So when the hemoglobin level falls, it means you are anemic. You are not supposed to donate blood. So this is where you will require supplementation, iron supplementation, clinical help to overcome anemia. Okay, and there are fourth stages as well, in which just by supplementation it is not helpful. For example, if your hemoglobin level is less than 6 gram per deciliter, in such situation you will require blood transfusion. If it is less than 6 gram or less than 5 gram, you will require clinical help, blood transfusion, etc. So clinically, we can find there is an immunocompetence is reduced, which means that your cell-mediated immunity, the way how you respond to allergies, the way how the cells respond to any foreign body that enters the body, that is reduced. Phagocytosis of your WBC, the way how your white blood cells can engulf any foreign body, including bacteria, virus, fungi, whatever the foreign body has entered the body, the way how the white blood cells can engulf and destroy it, that reduces. Okay, so putting you at the risk of future infection. Okay, so immunocompetence reduces in the body. Diminished work performance, you easily get tired. Okay, your work performance decreases. Lack of focus in whatever you do, even if it is studies, you are a student, you are studying, or you're working professional, you're working. Okay, your work performance fall down. That is another mark of anemia. And also when it comes to athletes, sports persons and athletes, your endurance decreases. Earlier you were able to do around 50 squats or something within 15 minutes. If you're anemic, your endurance reduces, your performance reduces. Okay, cognitive development, it is seen that in low birth weight babies as well, or in infants who had poor iron stores or who were anemic, when they grow out into children, or they even into their teenage, the score that they have, the IQ that they have, it is much diminished as compared to their peers. Okay, 50% of the brain development is also affected when the child is anemic for a pretty long time. Behavioral implications, showing that temper tantrums, very common, not just in particular age group, but in majority of the age group, throwing temper tantrums, not interacting much. Okay, lack of social life. And if you take an example of any toddler or an infant, they go into a stage of breath spells, which means they cry in such a way, they hold their breath and they will hold their breath and they cry. And there is no voice that comes out of their mouth, but we can understand that they are holding their breath and they're crying. Okay, and they're not able to vocalize anything, they're not able to breathe, and they go into a state, they may go unconscious because of the lack of breath. Okay, so these are the breath spells kind of cry, which if any child is showing a temper tantrum and going into this breath spells kind of a cry, high chance that the child is anemic. Phagophagia, which means ice eating. It's a kind of pica, okay, that is seen in anemia as well, iron deficiency anemia. Structural and function of skin and epithelial tissue also changes. If you are suffering from early, young age graying of hair, if it is not genetic, in some cases it is genetic, you can ask your parents or grandparents at what age their hair graying started. Okay, if they say after 30, 35, the hair started graying, and if you are just a early 20 individual and you are experiencing early hair graying or something like that, it means there are high chances that you are anemic. Your nails tend to become flatter. Okay, there is a natural curve to the nail that is gone. It appears flatter. It is brittle, easily broken. Okay, loss of hair, graying of hair. Please don't connect every hair loss to biotin deficiency. Okay, hair loss is not always related to biotin deficiency. There are other forms of deficiencies as well which can lead to hair loss. Okay, only by doing a complete blood serum analysis, nutritive analysis, you can understand what micronutrient you are deficient in, and accordingly you can manage it. Okay, if you are anemic and you are just eating this biotin gummies or biotin supplements and expecting your hair loss to vanish, it won't happen. Okay. Acne also, skin issues. Acne is also one of the, and anemia can cause that. Skin may appear very pale, and the lower eyelid, which you can see whenever you go to any doctor's office, just to check that if you're anemic, they just check your lower eyelid. Okay, if it appears pale, and that is another sign of anemia. And you can do the pinkness of your nails. Okay, it should appear peachish pink in color, healthy nails. If it appears very white, okay, very pale and very white, that is another sign of anemia. There are other symptoms also they have mentioned in the textbook, like angular stomatitis, that is you get rashes and skin itching and peeling near the end corners of your mouth. Okay, glistening appearance of the tongue, that is the tongue becomes very glossy. Okay, that is glossitis, inflamed tongue. Okay, these are the other skin based changes that you can visualize. There are other biochemical changes as well, like your oxygen transportation reduces, because if you're anemic, definitely oxygen transportation and cellular respiration reduces. There is no much exchange of oxygen and carbon dioxide taking place at cellular level. Okay, bactericidal activity reduces because your body is immunocompromised. Okay, the way how your body knows how to tackle bacteria, and that reduces. So you are at a higher risk of getting more and more infections. Porphyrin metabolism, for the heme synthesis, porphyrin is required. That metabolism reduces because of the absence of iron. Any pigment metabolism, formation of your melanocytes, etc. That is the reason why your skin appears very pale. DNA, RNA metabolism reduces. All this metabolism in which iron is required as a cofactor, everything will reduce. It will not come to a standstill, but the rate reduces much. So this is the diagnosis of anemia. Normal range along with the values with which you can say that, okay, the person is suffering from anemia. If the serum ferritin levels is less than 15 microgram per deciliter, anemic. Serum iron levels 10 to 15 microgram per deciliter, anemic. Transferrin saturation, again, if it is less than 15%, 30 to 50%, okay, that even if it is 25% or 20%, still you are considered anemic. Okay. Total plasma iron binding capacity. This happens in toxicity. Okay, these three things happens in toxicity. You can see the observation here, observation on inference here, which means it decreases. This blue arrow means in the first three inference it is decreased, means the person is anemic, and in the last three inference it is increased. It means the person may be suffering from toxicity. So these are the three main diagnoses you have to check for, or you should be aware of when it comes to diagnosis: serum ferritin levels, serum iron levels, serum transferritin saturation. These are the three main diagnoses that you have to be aware of. Hemoglobin is the final stage. When the hemoglobin levels are down, you require clinical medications, etc., to increase your iron stores. Next is the treatment. The first is the oral administration of ferrous sulfate along with folic acid. Ferrous sulfate 50 to 200 gram can be given. This is the oral administration is free of cost, given from any PHCs, and even in government schools and public schools for adolescent girls who have attained menarche, and even younger girls as well. Free of cost, these medications are given. In PHCs, community health centers, primary healthcare centers, for pregnant women, antenatal care, as a part of antenatal care, or administration of ferrous sulfate tablets and folic acid tablets are given free of cost. Okay. So this initiative is taken under the reproductive and child health programs for children and adolescent girls. They are given iron and folic acid tablets. So if a child is just 6 to 2 years of old and they are at a greater risk of irreversible damage that can happen because of long-term consequences of iron deficiency anemia, which will mentally impair them, their cognitive development may also get affected. So for them, 20 mg of elemental iron is given, and just 100 microgram of folic acid will be given in syrup form. And children who are below 5 years of age, again 20 mg of elemental iron, ferrous sulfate iron, and 100 microgram of folic acid is given for 100 days in a year. It has to be continued. Adolescent girls attaining, as soon as they attain menarche, as soon as they attain their first periods, they have to consume on a weekly basis 100 mg of elemental iron and 500 microgram of folic acid. So these, the micrograms which is mentioned, it is just for your knowledge. Only the doctors who are present here, only they can practice. But apart from that, as a nutritionist and dietitian, you are not supposed to practice this. I will do it then. Prevention. Yeah, prevention, we have the same programs, nutritional anemia and iron deficiency anemia control programs, and other nutrition programs do take place in India. Not just the Indian government, but also as a part of ICDS, International Child Development Schemes, and UNICEF and World Health Organization. They all have contributed towards uplifting the iron deficiency anemia situation in India. So a lot of nutritional programs are running, which are free of cost. Okay, even in Anganwadis, all the public health centers, government schools, government hospitals, okay, the iron tablets that you get is free of cost. But it is the older generation ones that we get in the government sector. But when you go to private sector, the newer generation ones you can get the heme versions as well, which does not have much of the side effects. Okay, so that is the main difference here. Dietary improvement, you have to give them the health education. Dietary improvement, health education starts in the school level as well. Okay, regarding anemia, if you recall, regarding anemia, you must have studied about this in early school phases as well, which are the food that are rich in iron. Specifically for girls, this health education is given. Okay, nowadays what's happening in the school I'm not aware of, but yeah, in early school age, as soon as after in the 6th grade and 7th grade syllabus regarding anemia chapters are there. Okay, this is the part of the educational system's involvement in enhancing the knowledge about the importance of iron deficiency anemia and the importance of iron in diet, specifically for teenage girls. Okay, so dietary improvement starts with education, starts with health education, starts with nutritional education for teenage girls, because specifically in rural India, teenage girls are still getting married away before they attain the age of 15 or 16. And teenage pregnancies are another cause of maternal mortality rates, infant mortality rates, okay, reducing reduced life expectancy rate. Okay, so dietary improvement starts with education, and then you can whenever you come across any clients, you can definitely give them pamphlets or give them references and guidelines. Supplementation we have discussed just now. What is the supplementation given to people at different age, especially adults and girls, children. Pregnant women, they are given 60 mg of elemental iron, 500 mg microgram of folic acid. They have to continue that for the 100 days for their entire pregnancy for the first trimester, and slowly in the second trimester doses will change based on the way how they react. Fortification. Salt fortification is present. It is not found in every stores. Tata salt, which is fortified with iron. There are other brands as well, iron and iodine fortified salt. It is not found anywhere, but if you go to any hypermarkets or supermarkets, you may come across this fortified iron fortified salt. Iron fortified oils are available. Milk is also available. Okay, certain states have incorporated iron fortification into milk as well, because milk is something majority of the population uses. Okay, so state-owned milk dietary programs and all, they will fortify that dairy products, etc., with fortified iron. So rich as well as the poor people, everyone consumes salt. So salt fortification is something that can be very successful, but it has not reached its full capacity yet. Okay, salt is something that rich, poor, everyone uses. Okay, and everyone can afford it. So that is one of the reasons why the government wanted to incorporate iron fortification into salt as well. So don't just go by the brand. Any brand which has iron fortified salt can be used. Then education, promotion of the consumption of pulses, green leafy vegetables. Okay, drumstick leaves, methi leaves. Okay, promote the pregnant women to eat more of these. Give them options as well. If they have any pica issues with this or morning sickness issues with this, give them alternatives. Okay, morning sickness issues, you do not have to give them liquid diets much. You have to give them dry food. More or less, you have to give more dry food than the liquid-based food. So keep an awareness of that as well. Mothers who are attending antenatal clinics, immunization, Anganwadi centers. Okay, these are your target clients. Okay, pregnant mothers and even the mothers who have given birth, who are lactating. Okay, who have children less than 5 years of age. Okay, these are the target population where you can make a quick change. Addition of iron-rich food in the weaning diet of the infants that I have mentioned earlier. As soon as you start the weaning diet, focus more on iron-rich food in the weaning diet. Regular consumption of food that is rich in vitamin C, because vitamin C will enhance the iron absorption. Promotion of home gardening, if it is possible. People who are living in flats and it is difficult, apartments and flats, it is difficult, but promote the home gardening situation wherever it is possible. School gardening as well.